Dr. Stewart, Timonium Foot and Ankle Center. I'm here with Cheryl. Cheryl, thanks for joining me today. Cheryl is coming in today because she has, let's come over here for a second, she has these really dorsally or popped up toes, these hammer toes that are pushing down and causing a lot of pain under her foot. You can see her left foot, she has this very painful skin lesion, what most people call a callus, but this is actually called a porokeratosis. If you look in the center, there's like a little circle there, and there's basically a sweat pore that fills up with skin, and it looks like she's it feels like she's walking on a painful pebble. So basically, Cheryl came in and she was dealing with a lot of pain. Cheryl, tell me, you're a flight attendant. You've been a flight attendant for 42 years, correct?
Yes, I have.
And tell me about your foot pain before we did any treatment.
Well, I had surgery on this foot, but I think because this toe goes down, I was walking and it just kept getting more calloused.
Right.
I would try to shave it off. It would help a little bit, but really, I was in extreme pain.
Right. She came to me pretty miserable, pretty bad off like a couple months ago. And, you know, she's an airline attendant. She cannot be off her feet for an extended period of time. And we talked about ways to treat her foot. And the options include, you know, making her an orthotic, which we did. And she's commented to me that they've been extremely helpful. But the only way to really correct this foot is to do big reconstructive surgery, which we could certainly do. However, that's an extended recovery and certainly a lot of risk, and it would keep her out of work for probably a good 3 to 6 months. What we ended up doing was our friendly dermal filler. We injected Radiesse dermal filler, and we did it about a month ago on the right foot. And this area, you can compare the 2 feet. You can see there's extensive callus here on the left foot, which we're going to do to the Radiesse today. The right foot looked exactly the same as the left one did about a month ago. And now there's minimal callus and essentially no pain. How did you do with the treatment, and how would you say the results were?
I think the results were excellent. I was extremely surprised. Like when you touch this foot, it doesn't hurt, but when you touch this one, it still does. So
right.
I want to get it done in
And we're going to do it today. So Radiesse dermal filler, just so everybody knows, it's a filler. It's kind of the consistency of like toothpaste. It's not literally toothpaste. It's a calcium-based product and a gel carrier that's subcutaneously injected into the skin. It's originally designed for plastic surgery for the hands and face. We use it in the foot to act as a filler. So if this is the skin and this is the bone, it kind of fills the void so you're walking on a soft area, and you can really see that. This is used in conjunction with supportive shoe gear. It's used in conjunction with orthotics. And we'll continue, if needed, to shave some of this callus down. But it's a very effective tool in reducing pain. The recovery is very minimal. She's walking right away. We had her use an all-floating aperture pad. And essentially, it's a very good non-surgical way to manage these conditions. The procedure is done right here in the office. It takes a few minutes. And we'll treat her left foot today, and we'll revisit this. So thank you. If you're considering a good non-surgical option to treat these painful skin lesions on the bottom of the foot, Radiesse dermal filler is a very effective tool. And you can hear it from our patient.
I definitely agree.
Okay. So thank you. This is Dr. Stewart, Timonium Foot and Ankle Center. You can visit our website at www.timoniumfootandankle.com.